Hello, I'm Dr. Norma DeVault, PhD in Nutrition, MBA, registered and licensed dietitian. Diabetes, are you at risk? I'll talk a little bit about reducing risk with lifestyle changes and how to manage diabetes if you have it. To look at your risk, first, look at your weight. What is your body mass index? If it's greater than 25, you're at higher risk. And your waist measurement? For women, a waist measurement greater than 35 is a risk factor, and for men, a waist measurement greater than 40 inches. You can either calculate your BMI, or there are several tables available online or BMI calculators. Underweight is a BMI less than 18.5. A normal weight is 18.5 to 24.9. Overweight is 25 to 29.9, and anything above 30 is classified as obese. To reduce your weight, decrease your usual portions. Reducing portions by 100 calories per day will result in 10 pounds weight loss per year. 200 calories, 20 pounds. 300 calories, 30 pounds. You also will need to increase your whole grains and fiber. Choose whole grains instead of processed flours at most of your meals. 3/4 of a cup of whole grain cereal and 2 slices of whole grain bread are examples of 3 whole grain servings. Choose foods that have 3 to 5 grams of fiber or more, or about 20 to 35 grams of fiber per day. But a caution, drink plenty of water, 64 ounces or more, when you increase your dietary fiber. Also choose healthy carbs. Choose a minimum of 130 grams of total carbs per day to get all the needed vitamins and minerals. A typical intake would be for a 1,200 calorie diet, 135 grams, for 1,800 calories, 195 grams. Healthy carbs are whole grains, bread, cereals, crackers, lentils, beans, peas, sweet potato, low-carb pasta, brown rice, fruits and vegetables, fat-free and no sugar added milk, and yogurt. Healthy carbs include fruits, fruit the size of a tennis ball. That would be like a whole apple, a whole pear. Cut fruit or berries, 1 cup portion. For canned fruits, look for juices, not syrup. Healthy carbs include cereals, whole grain, high fiber, oats and bran cereals. And bread, look for whole grain as the first ingredient on the nutrition label. And look for 2 or more grams of fiber per slice of bread. Include low-carb vegetables, including all non-starchy vegetables that are fresh or frozen. Eat them in moderation for starchy vegetables, which would include potatoes, corn, peas, and lima beans. Also learn to read food labels. Eat leaner proteins. Include at least 2 servings of fish per week and not fried fish. Choose 3 to 4 ounce servings of skinless chicken, turkey, pork loin, lean beef such as from round roast beef or for lunch or dinner. Eat 2 eggs per week or egg whites more often. And try vegetarian proteins. You might like them. Tofu, soybeans, beans and lentils, vegetable protein products. Also decrease your high-fat proteins. High-fat proteins include ground beef, especially chuck, steak, especially ribeye, sausage, bacon, country ham. Those are all high-fat, as is cheese, hot dogs, salami, bologna, liverwurst. You'll want to choose healthy fats in moderation. Use olive oil or canola oil. Peanut butter, nuts and seeds, olives, and avocado have healthy fats, but limit your fried foods, creams, and gravies. A healthy eating plan would include 2 to 3 portions of low-fat or fat-free dairy, 2 to 3 small fresh fruit about the size of a baseball, an unlimited amount, 3 cups or more, of your low-carb, non-starchy vegetables, low-fat proteins, and healthy oils. Eliminate sweetened or fizzy soft drinks. And a caution about alcohol. A small amount of alcohol has been shown to be beneficial, but a small amount means 1 to 2 for women, 3 drinks per week for women, or 1 to 2 per day for men, if you choose to drink and if it is not medically contraindicated. No studies have shown that if you don't drink, you should start. Exercise. Aim for 270 minutes per week. That's 20 to 30 minutes twice a day. Try using a pedometer. Just see how many steps you take in a normal day. 2,000 steps is a mile, so aim for about 10,000 steps per day. And you might want to work out with light weights to increase your lean body mass. If you desire to lose weight, you should get 60 to 90 minutes of activity each day. You can calculate your safe heart rate for exercise and make sure that you stay within a healthy range. So how do you reduce your risk for developing diabetes? A healthy lifestyle, healthy diet, fast foods rarely, exercise often, quit smoking or don't start, and reduce your stress. Manage challenges head on. Use exercise and relaxation techniques. If you have diabetes, you have been diagnosed, then you'll want to be familiar with the ABCs of diabetes care. The A is for A1C. That's the blood glucose test that looks at your 3-month average of blood glucose level. B stands for blood pressure, and C for cholesterol. All 3 of those measures are going to be critical to help you manage your diabetes. Diabetes is a disease that causes you to have extra sugar in your blood. High sugar in the blood can cause problems with poor vision or blindness, kidney disease, heart attacks or strokes, numbness, tingling, or pain in your nerve endings, that's peripheral nerve damage, foot sores and foot pain, less blood flow, and more frequent infections and slower wound healing. But if you control your blood sugar, you can help to stop or delay these complications. Well, what does your blood sugar test result mean? You can check with your doctor or your registered dietitian to look at what does it mean if your blood sugar is over 300 or if it's below 70. If you're worried that your blood sugar is too high or too low, call your doctor or your registered dietitian. Know the signs of diabetes. Tired or sleepy a lot, if you need to urinate often, if you have numbness or tingling in your hands or feet, wounds that won't heal, vaginal infections, problems having sex, blurry vision, sudden weight loss, or if you're hungry all the time or always thirsty. There are also symptoms easily recognized for low blood sugar, caused by too little food or skipping a meal, too much insulin or diabetes pills, or being more active than usual. The onset may be sudden and you may pass out if untreated, so you need to recognize symptoms of low blood sugar as well as high blood sugar. Low blood sugar can cause you to be shaky, have a fast heartbeat, sweating, dizzy, anxious, hungry, blurry vision, weakness or fatigue, headache, or irritable. And generally you can just eat one carb, like a slice of bread, half a cup of juice, to help bring some your blood sugar back into a normal range. What to do is check your blood sugar often, continue to take your medication, and follow your meal plan, drink lots of water, and exercise as you're able to. If your blood sugar is higher than your goal for a few days and you don't know why, call your doctor or health clinic right away. You can also use your plate to control your carbs. A quick and easy method of managing your carb is just to look at your plate. You should have half of your plate with lower carb foods, and these are all you can eat. 1/4 of your plate should be your protein foods. About the size of the palm of your hand would be a serving of protein, and the other 1/4 of your plate would be your higher carb foods, such as your starchy vegetables. You also need to follow an exercise plan. Well, why should you exercise? It's good for your diabetes. It helps lower your blood sugar, helps you to lose weight, and helps you to feel better. What kind of exercise will you do? walk, ride a bike, dance, swim, or whatever else. The best exercise for you is the one that you will do. And when will you exercise? Make a plan and stick to it. If you follow these directions, you will help to build confidence in your ability to manage your diabetes. Best of help to all of you.